Hello and welcome to Trans for Doctors. In this video we're going to talk about how medical professionals can actively aid an individual in transitioning in terms of referrals. I do feel that the word transitioning is a bit of a misnomer really, as all individuals in life transition. We don't just stay still, we all self-develop, just that trans people, in regards to their gender, they transition in that way. Nobody stays exactly the same for the next 10 years, do they? A lot of issues here are very specific to how the NHS operates. Private GPs may still find this useful, but there might be a bit of tinkering around and figuring out what's really useful for your service users, really. I'll talk about medication in a separate video, as well as information on current up-to-date guidelines for prescribing and what challenges you may face. For now, this is strictly focused on the traditional model, the GIC model, that is supposed to be in place. It's imperative that if an individual expresses a desire to transition, well, you make that referral as soon as you possibly can, because waiting times for GICs can be up to 2 or 4 years right now, depending on the clinic. And medication is not usually given on the first appointment, it's usually on the second, so that usually takes another year. You should make that referral. But just be aware that the system is completely and utterly broken right now. The system is completely overwhelmed. More and more trans people are feeling safe to come out, therefore that's why there's an increase in how many trans people coming to services. It's well known that with these waiting lists, people can turn suicidal, they can have severe issues, they can have a bit of a crap time in life really. Again, all that we want to do here is just live our lives, but we're stuck in this invisible waiting list and we can't do anything about it, and there's delays and it's just terrible. It's an absolute national disgrace. You have to be aware that a lot of these clinics operate on a do we deem you as trans model really, which is ridiculous for the 21st century, but that's just how it is right now. Thankfully, things are changing, slowly. There are now pilots running, such as in Manchester, we've got Indigo Gender Services, which are amazing. They ran by actual trans people, and they'll be affirmative and they'll use a person-centered approach, which is great. Some of them, like Gender Indigo Services, also operate hotlines for GPs, which you should absolutely call if you ever get stuck on how to help someone. Importantly, it's not based about proving your existence, which is ridiculous, but rather you've got that whole person-centered approach that I've just talked about. These pilots are still new, and they're restricted most of the time to taking patients off current GIC waiting lists. There are also pilots that depend on future government funding, which if you find these services useful, please give them feedback and help them to justify themselves to the government to exist. Unfortunately, these are adult services. When it comes to children and adolescents, the equivalent is GIDS. Tavistock Gender Clinic is in the process of being shut down for failures in care, and so there's really no options left anymore. It's a tragic situation, and really, people are really struggling. Trans children do exist. And in fact, treating them at that point will prevent a lot of issues further down the line. Please note, GIDS is going to be replaced with local services up and down the country, as recommended by the CAS report. However, we still don't know when that'll happen as of the time of recording. Please keep this in mind in supporting trans children, as you still should provide the most care you possibly can. That's all for referrals. In the next video we'll talk about medication options that exist for trans people that are supported by current medical guidelines.